Many men notice changes in erection quality as they get older and are told it's simply normal aging. While age does influence the body, that explanation is incomplete. Male sexual function does not suddenly shut down with time. It changes when certain physiological systems receive less stimulation, less movement, and less neural engagement. To understand why firmness may fade, especially in the morning or during intimacy, it helps to understand how erections actually work. An erection depends on three core systems working together: blood vessels, nerves, and muscles. Hormones play a supporting role, but they are not usually the main limiting factor in men who can still become aroused. When arousal begins, the brain sends signals through the nervous system to blood vessels in the pelvis. These vessels relax, allowing blood to flow into erectile tissue. This is often described as the blood inflow phase. Many men assume that this step alone explains firmness. But there is a second, equally important phase that is often overlooked: blood retention. Once blood enters erectile tissue, it must be trapped there. This happens through the coordinated action of small pelvic floor muscles, primarily the bulbocavernosus and ischiocavernosus muscles. These muscles compress the veins that would otherwise allow blood to drain away. When they function well, pressure is maintained and firmness stays stable. Research has shown that weakness or poor coordination of these muscles is associated with reduced erection rigidity and difficulty maintaining firmness, even when blood flow into the penis is adequate. As men age, several factors can interfere with this system. Prolonged sitting, reduced physical activity, chronic stress, and shallow breathing patterns can all reduce pelvic floor muscle responsiveness. Over time, muscles that are rarely engaged become less reactive. Nerve signaling can also become less efficient when tissues remain tight or underused. This does not mean the system is damaged. In most cases, it means the system is understimulated. Studies published in journals such as the Journal of Sexual Medicine and Urology have shown that targeted pelvic floor muscle training can significantly improve erectile function in men with mild to moderate erectile difficulties. These improvements are not limited to younger men. Older men often benefit as well, sometimes within weeks. One randomized controlled trial found that men who performed structured pelvic floor exercises experienced better rigidity, longer duration, and improved confidence compared to control groups receiving lifestyle advice alone. Breathing and circulation also matter. Deep, slow diaphragmatic breathing improves oxygen delivery and increases nitric oxide availability in blood vessels. Nitric oxide is a key molecule involved in vascular relaxation and erectile response. Shallow breathing, which often accompanies stress, reduces this effect. Lifestyle factors further influence nerve and vessel health. Excessive sugar intake, smoking, unmanaged blood pressure, and poor sleep can damage blood vessel lining and impair nerve conduction over time. These factors often accumulate silently and are mistakenly attributed solely to age. Morning erections, often called nocturnal penile tumescence, are a useful indicator of vascular and nerve health. Their reduction does not automatically indicate disease, but persistent absence can reflect reduced nerve signaling, poor sleep quality, or compromised circulation. The encouraging finding from medical literature is that many of these changes are reversible or at least modifiable. Gentle pelvic floor activation, improved posture, regular movement, hydration, and stress management can restore communication between the brain and pelvic tissues. Importantly, this process is not about force or intensity. Overexertion can worsen tension and inhibit proper muscle coordination. Consistency and awareness matter more than strength. Medical guidelines emphasize that men experiencing persistent or distressing erectile changes should consult a qualified healthcare professional. Erectile changes can sometimes be early markers of cardiovascular disease, diabetes, or neurological conditions. Education should support, not replace, proper medical evaluation. Understanding the underlying mechanisms removes unnecessary fear. Many men assume decline is inevitable and stop paying attention to the signals their body provides. When silence is interpreted as failure, inactivity follows. When silence is interpreted as feedback, adjustment becomes possible. Male sexual function is not a single switch that turns off with age. It is a coordinated system that responds to use, circulation, and neural engagement. when those inputs are restored, function often improves. This knowledge does not promise instant transformation, and it should not be treated as a substitute for medical care. It offers something more reliable: clarity. When men understand how their bodies work, they can make informed decisions rather than surrendering to myths about aging.